this is what underpins all of cosmetic dentistry, is photography and communication. It doesn't matter what you do or don't know. It doesn't matter what you're capable of doing at that point in time. If you have communication under your belt, you can do anything. There's a magic number that everyone has that they feel confident saying, and anything above that number, your voice suddenly drops and you get really quiet and you can't actually communicate what you're talking about. It was difficult for me to talk about anything above $2,000 to someone. It was a struggle for me to think about paying $2,000, let alone expecting $2,000 from someone else. Practice in front of a mirror and practice saying bigger numbers. Practice saying $10,000 with confidence. Practice saying $20,000 with confidence. Look me dead in the eye and say $50,000 with confidence.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker.
Hi CPD Junkie fam, I'm your host, Dr Laurence Doan, and today we're joined by Dr Vineel Chunduru. He graduated from Adelaide in 2017. He started his career in rural Victoria and Melbourne, and at the height of Melbourne lockdowns, he decided he wanted to move to SA, where he has continued his clinical practice since. Vineel has experienced both ends of the mentorship spectrum and aims to be a jack of all trades by CPD in all fields of dentistry, and a mentor for anyone willing to listen. Currently, he practices and centers around orthodontics, wisdom tooth surgery, full mouth rehabilitations, and non-surgical periodontal debridements. Dr. Vineel, welcome to the show.
Hello, how are you?
So, full disclosure, me and Dr. Vineel graduated in the same cohort in Adelaide. So at one point, he was actually the AUDSS Community Aid Executive Officer, and I was his subcommittee member, but have there been much community work since then?
Gotta pull my, yeah, about that. Look, I try to take on as many public cases as I can, and teaching is kind of my way of giving back now. So work at the university part-time, that's only half a day for a week, but also do a lot of mentorship outside of the university. So that's kind of my community approach for now. But eventually I do want to make some time and go overseas. And if you recall, we did the Trivia for Timor event for a couple of years. And I really, really want to go overseas and volunteer as part of that project. And yeah, we'll see how we go.
We'll definitely dive into some of those roles that you just talked about. So tell us about your CPD or dental journey so far.
So it's pretty much kind of all over the place. A lot of it has more to do with clinical experience and just having really, really good mentors throughout my career, as opposed to very specific CPD. I've only recently started to streamline on CPD and how I kind of approach that. So, in terms of mentors, I've got, my brother, which you guys would already be aware of, Dr Chunduru.
Yes, a previous guest on our show, yes.
And, career leader in terms of prosthodontics and Rempros in particular, but, just about anything and everything, and a very humble human being. And I'm not at all biased when it comes to my brother, not at all. And then, of course, there's Sam Coe as well, who I only worked briefly with for about 6 months, but absolutely influential, huge part of my career growth, and more currently and recently, Michael Francis, who I work with at Semaphore Dental. I know I kind of went off topic. Your question was about CPD. And
let's go into it, because obviously we're there now. Okay, so pros. When did that kind of come about with your brother being a prosthodontist? Like, was that from the get-go? Like, for our listeners, because they won't know about this, what happened was that you graduated and you're like, okay, I need some help with pros. I'm gonna go to my brother and he's gonna help me out.
It was more like he kind of got me into. He helped me consider dentistry as an option right from the start. So he was very much a part of my dental career from first year uni. So I don't consider myself an expert in pros in any way, shape, or form. I think
Doesn't it just happen through osmosis? Don't you just absorb it?
Well, actually, the funny thing is, back when he was a dental student, whenever he needed to revise for any kind of exams or anything like that, he'd call me up and he'd start teaching me random stuff. And at the time, I had absolutely zero interest in dentistry. So I'm sitting here going, oh God, more teeth. Why? What have I done in my life? But it just turned out to be really, really useful knowledge in the future when I did go into dentistry. So even now, if I do come across a denture case or a TMD case that I just really don't know what I'm doing, he's pretty much right at the top of the list of people that I call straight away to figure out what's going on.
Yeah. So, okay, I'll backtrack it for us, for our listeners. So basically you graduate, right? You end up in rural Victoria, right? At this point, how are you picking your courses, the commute, on all of that? Great thing is like you're in Victoria, so that's a place where there's a lot of CPD. So how do you guys go picking your courses?
At the time, I didn't have a proper system in place. So I was just doing whatever would get my hours up. So that was a lot of the ADA, VB, free CPD hours. That was
online you're talking about right now, like online CPD?
Yeah. Online, yeah. That was attending the conference in Melbourne. That was attending a couple of endodontic lectures because I felt like I didn't really know enough about rotary. If you recall, it was very, very hard to get a hold of the rotary unit in the ADH. So very few of us got any experience as a student. It was a matter of just going for, just about. I didn't really think about it. I didn't think about the topics. I was purely after, let's get the hours, let's just go either on the computer or go into the city and just max out the hours. And genuinely, I felt like as far as CPD goes, the first year was a little bit of a waste because I didn't take that opportunity to learn and to keep myself up to date. It did mean that I was spending a lot of time regional and rural just practicing dentistry nonstop. So I'd be practicing 9 or 10 hours a day, 4 days a week.
Wow.
So a lot of clinical experience, a lot of clinical practice, but as far as CPD journey goes, not the most useful. I think what was really useful though was that I can't remember the oral surgeon's name, which is terrible. But there was a guy who moved to Albury-Wodonga, and he was an absolutely amazing oral surgeon. And so 1 to 2 days a week, I'd actually drive up to Albury-Wodonga and just spend the whole day in surgical theatre with him, assisting and just learning face to face as opposed to through controlled CPD hours.
Yeah, I mean it's one thing to for them to talk about it, but it's another thing to actually see them and actually either apply it, or in my experience is like you see like they come across complications potentially, or like something that doesn't go accordingly, and you see how they deviate and how they manage that, and then that's something that unless you're there you won't know.
Exactly. And the funny thing is, the only cases that ever came across his lap were when general dentists either went out of their scope or was, it was a bit of a struggle town kind of case that needed the assistance of an oral surgeon, right? So you don't usually send your standard 311s over to an oral surgeon. As a result, it means that all I was ever seeing were management of complications, which was again absolutely fantastic and the main stepping stone I needed to gain confidence in doing wisdom tooth surgery myself.
So you're saying you're wisdom tooth since expert now?
No never, absolutely never.
Well, I mean, what did it teach you? I mean, like obviously there's a point where you have to transition from seeing what's happening to applying what you know.
So because he was the only oral surgeon in a 100-kilometer radius to my clinics, it meant that a lot of my cases were being referred off, or my colleagues' cases were being referred off to him. So it meant that there was an opportunity for me to be involved in the surgery as well. So more often than not, if I did feel like it was a tricky extraction, I'd say, hey, look, did you want to do this under GA with an oral surgeon supervising? And 9 times out of 10, the patient's going to be like, yeah, heck yeah. So that meant that I could go to him with these cases, and in a surgical theatre setting, do these extractions while having the hands of a OMFS right next to me to bail me out, or to assist in any way, or just to point in the right direction. No, just drill a little bit more here, trough a little bit more here, luxate a little bit more, make sure that you're aiming at, putting it in this direction. He taught me how to do orthodontal communication closures. So, doing a double soft tissue closure, how to drag out the buccal fatty pad and suture it onto the palate. So not that I've had to use those skills in years, but if it ever comes up, I know what to do.
Yeah, cool. So that's how you are training and you're improving on your wisdom teeth management and complications of oral surgery. I mean, does that stop there? Like, obviously you mentioned orthodontics, full mouth rehabilitation, non-surgical perio. How do we kind of dive into that, and when does that happen?
So with the non-surgical perio, again, that's not so much of a CPD journey as opposed to more of a clinical experience journey. When I first joined up with in my first clinic, and also when I joined up with Sanko, the question came across like, hey, do you like perio? And me being me, I said, I don't mind. As far as everyone else was concerned, that's great. You're now the perio expert. We're going to chuck every single perio case at you. So with very little experience, it meant that I just had to level up really, really quickly as I'm doing all these non-surgical root debridements. So I ended up kind of developing my own clinical practice and clinical workflow. And most recently, when I attended Leo Lander's Noble Perio course, that was a really lovely little confirmation or affirmation that my workflow is very similar, if not the same, as that of the specialists. But yeah, that's a little bit of a tangent there. But effectively, with the non-surgical perio debridements, that's just purely clinical practice, and not every other dentist saying, Siebes, I can't be stopped doing it. It's on you.
Yeah. And I mean, is there a reason why you maybe would have stopped at non-surgical? Like, are you considering surgical at the moment, or is you're happy with how everything is at the moment?
So, I mean, ultimately, I still feel like a specialist is going to be better than me, or a hygienist who does debridements day in, day out is still going to be better than me. So I kind of limit myself to, those kind of cases where, a hygienist may say, hey, I think you need to see a specialist, and they refuse to see a specialist. Then I'll step in and say, okay, I'll give it a go with no really promises or guarantees, and see if that helps to reduce the situation. If it doesn't, then at least we've tried everything in-house. And then in terms of the surgical perio debridements, I feel more comfortable referring those out. Eventually, I do want to have that kind of confidence, but again, it's one of those things where I haven't done any formal courses or CPD for, so that's something that I would like to look at in the future for sure.
Okay, so you're at Sanko's practice. I mean, does orthodontics kind of come up, or full mouth rehabilitation kind of come up?
Yeah. So he's the main reason why I'm in ortho. He's the main reason for a lot of things. So if things panned out the way I planned things to plan out, I would be just doing either community-based dentistry or just working in full-time public, serving the community, and happy with that and not doing anything else. And then I worked for Sam. And Sam, he pushes for everything. And he looked at me and he's like, "Do you want to be a cosmetic dentist?" And I'm like,
Sure.
his answer was yes, you do. That's the only answer I'll accept. I'm like, fine. And I remember talking to a couple of other dentists while I was working for Samco, and every single one of them said, "Hey, look, you work for the guy who teaches orthodontists how to do ortho. Whether or not you like it, you're in the prime position and opportunity to learn. And if you don't, you're going to regret all of this later." So naturally, when Sam asked me, "Do you want to learn clear correct? Do you want to learn clear aligners?" there was only one answer that was acceptable: yes. I learned clear aligners, and I learned how to do clear aligners from Sam himself, and he was absolutely fantastic as a clinical mentor himself, because he would throw his cases at me, from start, middle to finish, and cases that required some troubleshooting, like bootstrapping or anything else. He'd throw those at me as well, just so that I could actually absorb it all and learn it all. Even during that short 6-month stint that I was working for him, it meant that I could take on a case start to finish, no problems, no worries, without any real assistance, if need be. What also happened was the inspiration to then take on fixed ortho, because me being me, I don't really have that much of an appetite for risk. And so I wanted to at least have the ability to chuck on some brackets if need be, if teeth don't track the way we want them to. As we know, the software is very optimistic at the best of times. So I turned to him and I said, "Okay, which fixed ortho course should I go for?" And this is a man who's done both POS and EODO. And he said, "All right, cool. Looking at you," specifically me, Vineel, hello. Looking at you, you're the kind of person that needs textbook orthodontics first before you learn contemporary." I'm like, "Yep, that sounds right." So he threw me in the direction of POS. So I've been doing that for the last 2 years. And I feel like I've gone off track at some point.
No, you haven't. You're still talking about your orthodontic journey, how now you're in the realm of fixed when you initially started out removable. Because you got to understand, a lot of our listeners who are recent graduates, when they come out, they hear about clear aligners. They hear about, "Oh, I don't want to," they're hearing about Invisalign or of that sort. And that's what the patient's coming in asking for. And so naturally they gravitate towards clear aligners first, as opposed to traditional fixed orthodontics. I mean, now that you started out that path and in an environment where you've had that support, I mean, is it interesting enough that, you're still considering the fixed option? Like, I think that for listeners is going to be interesting.
Yeah. It's really strange. I mean, I started off doing fixed just as a in case clear aligners doesn't work out. And now, having finished the majority of the course and taken on a couple of cases, my entire mindset's just flipped. And now it's kind of like, oh, if we do this in fixed, easy. This is easy as heck. If you want me to do this in clear aligners, that's when it's going to get a bit trickier. So having that kind of foundational knowledge and understanding of the clinical outcome has really helped to determine and dictate the fact that and consolidate what everyone tells you, what the orthodontists already tell you, which is that fixed, there's a lot that can be achieved. Now, that being said, clear aligners is an emerging technology, and that's always changing. So naturally, a lot of people are now coming out and saying that you can achieve just as much, if not more, with clear aligners. But it's a matter of understanding the biomechanics of moving teeth that can allow for you to achieve what you want to achieve with clear aligners. And at least in my limited training, knowledge, and experience, fixed seems to be the easiest way of shifting teeth in a controlled way anyways.
Yeah, fair enough. I mean, so what would your advice be to give to someone who's just starting their dental education? In particular, in this case, orthodontics. Would you say dive into fixed first, or would you say, actually, no, it's okay. If you're in the right environment, just start off with, clear aligners?
I mean, by all means, if you want to stick to clear aligners, stick to clear aligners, because it is like jumping down a rabbit hole when you start looking at fixed. 2 years on, I feel like I know nothing. So,
Full disclaimer.
Sorry.
Full disclaimer.
Yeah, but it's the whole Dunning-Kruger effect. The more you know, the less you know, right? So, once I finish POS, I have no doubts in my mind that I'm gonna start doing EODO. And once I finish EODO, then I'll go through whatever courses are available through Jeff Hall's OrthoEd. So I'm planning on doing the whole shebang, just not all at the same time. There's so much information to take on.
That's fair enough.
But
fair enough. Yeah, I mean, yes. Sorry.
No, you go.
No, I was just saying, so obviously, you're in the mindset that, okay, Dr. Vineel, you're a cosmetic dentist. Cosmetic dentistry isn't just removal, clear aligners, sorry. So there's other aspects, there's composite veneers, there's whitening.
Yeah.
So how did you go about in that realm?
Before I jump into that, to answer the question about, new graduates taking on clear aligners, take on clear aligners, but make sure that you do a really, really comprehensive course. Don't just do a 1 or 2 day weekend course and think that you're ready to do clear aligners, because there is just so many limitations. You need to know how to send back and how to truly analyze the clin checks that are being sent back to you, how to best instruct your technicians how to deliver the result that you're after, and how to manipulate the plastic or the material as best as possible to your advantage. And that's not something that can easily be covered in 48 hours.
Mm-hmm.
Anyways, so yeah,
that's what you did. I mean, would you say that? I mean, some people would argue, that I'm happy to do, a couple of weekends as opposed to just one weekend. What would you say to that? They kind of want to feel it. They want to feel out the water if this is something they want to go into. Are you saying that, I mean, I don't want to put words in your mouth, but, correct me if I'm wrong though. Like, are you saying, look, you can't just dabble in it. You actually have to fully commit to something comprehensive before you make that judgment? I
mean, have cases. Just be really, really picky and have someone that you can at least run those cases by, whether it's the regular orthodontist that you refer to, or a mentor that you can trust and has a fair bit of experience with clear aligners. Run those cases by them just to make sure that it is something within the realm of simple, straightforward, just aligning a couple of front teeth or closing some diastemas or something like that.
Yeah, because you gotta understand, a lot of graduates come out, they're like, I want to learn ortho, I want to learn implants, I want to learn it all really quickly and just do it all, right? And for them, it's kind of like, sometimes, like you alluded to, sometimes you might not have someone there to help you, but it's like, I really want to learn it. How do I implement it? And, there's so many clear aligners out there. How do I pick one?
That actually brings up a point. I always get a little bit annoyed whenever someone says, I don't have a mentor. I don't have someone to run cases by. If you have a referral network, you have mentors. It's just because you don't have someone next to you or in your clinic doesn't mean that you don't have access to mentors. You had clinical tutors that you relied on when you were a student, and professors. And I'm pretty sure they would still be very, very happy to take your emails and to look at your clinical records and to give you some advice or feedback on them. And again, going back to the referral network, most specialists are really, really happy to guide new graduate general dentists in the right direction, because they don't want you to be sending crappy records with crappy cases with, they don't want crap being sent to them. They want good cases, good records, good everything. And the easiest and the best way to do that is to make sure that the general dentist that's referring to them actually knows what they're doing. So Just like with my first year out, I went to the oral surgeon. He didn't approach me. He didn't say, "Hey, do you want to come observe cases with me?" I went to him and said, "Hey, I don't know enough about oral surgery, and there are so many farmers coming to me wanting these really broken down teeth out ASAP. Help."
Yeah, no, I hear you very loud and clear. So, to answer your question, to answer the question, yeah, I mean, amongst other things, mentors is one aspect, you've addressed it. The other one is, how do I decide to pick amongst the aligners? Because there's so many different ones out there.
How do you pick aligners? They're all much of a muchness. They all have different. They do have slight differences, but in terms of the principles, they're all fairly similar. Pick one and just pick one that maybe your mentors or the people that you're running cases by uses. So that way, there's a little bit of familiarity in terms of manipulating the software.
Sure. So let's dive back into you being a cosmetic dentist, Dr. Vineel. What other aspects are you what other things are you learning on top of the aligners?
Okay. So I mean, what am I learning? What am I learning?
Cosmetic veneers, whitening.
Whitening, again, that's a Sam Coe thing. He looked at me and said, "Have you ever whitened teeth before?" This was when I first started with him. I looked at him blankly. I'm like, no. There was one module in fourth year or fifth year. That was about it. And so he's like, "Oh, cool." And he booked me out for the next 2 weeks with all of his in-chair whitening. I mean, it was really convenient for him to have someone to do that, to throw all those cases onto and free up his books. But it also meant a lot of clinical experience for me in terms of just smashing through a lot of in-chair whitening, talking about the risks and complications. A lot of people coming back because I didn't put the gingival barrier on properly with ulceration, gingiva, a lot of sensitivity in managing that as well, and just being able to communicate very quickly and efficiently how to do all of that. So that was whitening. In terms of resin veneers, that's when so again, there's so much that I have Sam to thank for. So his name is going to come up a lot. He's the one who's actually started making me a lot more picky and choosy about what kind of CPD I do. And as you may know, he used to run a Young Dentist Hub, and he ran quite a few kind of CPD programs and seminars and all the rest of it. So he was not only a speaker, but he was an organizer for quite a bit. And so he basically said, "Well, you work for me now, so you're going to attend all of the CPD." So a lot of it had to do with... Yeah, look, I had to work my rear off, so I'm going to say for free on paper.
More in-chair whitening sessions.
And help with logistics and organizing. Yeah. But no, it was went to a lot of courses about resin veneers, about injection molding, about layering composites. What's her name? RL Hailey Castillo. Is that a familiar name to you? No, okay. She does a lot on resin veneers, so I learned a lot from her. And again, Sam Coe himself, he used to almost entirely do resin veneers. Even though his porcelain work was really good, he still did a lot of resin veneers. And if you look early on through his Instagram page, it's almost entirely resin veneer work. So again, anytime I got a cancellation or an FTA, I was just in his room watching and observing and reapplying those same principles. And, he really, really forced me to work on my photography so that I could come back to him and report to him at the end of every day or every week and just go through every case. And then he'd go through burr angulation. He'd go through the list of different soft-flex discs that he'd work his way through in terms of polishing, how he'd actually create the secondary and tertiary anatomy on those teeth. He really gave me the tools for critical thinking so that I could look at a case and go, okay, that's why that tooth looks a little bit shoddy or funky. And the key thing that he really, really gave me, and this is what underpins all of cosmetic dentistry, is photography and communication. He would really, really, really push that point, and now to me that's the most critical thing. It doesn't matter what you don't or what you do or don't know. It doesn't matter what you're capable of doing at that point in time. If you have communication under your belt, you can do anything.
Yeah.
That being said, please make sure that you have clinical experience and you go to the appropriate CPD and training before you attempt any funky business. Don't place implants without any CPD.
Do it ethically. Do it ethically. Yeah, do it ethically. So let's talk about, okay, so communication. Did you do any particular courses on it, or was it more just him kind of directing you, kind of educating you, on how to communicate better?
He gave me a lot. So for me, there's a lot that can be said about communication. So for me, so a little bit of backstory. I don't come from, an affluent family or anything. I would say our family was either below or just at the average income level. So for me, when I first started talking about expensive dentistry and big numbers, this is what Sam said, there's a magic number that everyone has that they feel confident saying, and anything above that number, your voice suddenly drops and you get really quiet and you can't actually communicate what you're talking about. And so,
this is not an ASMR video for our listeners, but yes, here.
Well, I mean, sorry, I didn't mean to, but so I mean, even he had a number at the time, and I can't recall his number, but mine was quite low. So when I started with him, my magic number was $2,000. If a treatment plan was less than $2,000, which is very kind of basic dental, I could bring out that number easy, and I'd talk to you about your treatment options and your plan and how we're going to go about things. The moment it jumped above 2,000, my voice got really quiet, and you could actually tell body language and everything. I would shrink back from my chair. It was difficult for me to talk about anything above $2,000 to someone. It was a struggle for me to think about paying $2,000, let alone expecting $2,000 from someone else. And so one of the very first things that he kind of pushed towards was, practice in front of a mirror. And practice saying bigger numbers, practice saying $10,000 with confidence, practice saying $20,000 with confidence. Look me dead in the eye and say $50,000 with confidence. So that was number one. And that, again, this was advice that was more specific to me. So it's not advice for everyone. It was tailored advice for someone who struggled with large sums of money, struggled to communicate large sums of money. In terms of the communication CPD, one that he recommended was Prime Speak, but to take that with a grain of salt, because it can be more about, it can be portrayed or construed as more about money making as opposed to actually communicating treatment plans. He himself did a lot of CPD, ran a lot of CPD on communication, and he ran a communication symposium with him, with a couple of people from Prime, I believe, from John Hagliassis, if I recall correctly, from Aorta, from Chidam Capel, yeah. And there was one other fella. So he had people from various organizations come together and talk about communication.
Was it Fatty Yasmin? Was it?
Sorry.
Was it Fatty Yasmin?
Yeah, it was Fatty. Yeah, it was Fatty. Yeah. So and the key principles from that were stuff that he was nagging me from from day one that I joined up with him, and that was being confident with the numbers, being confident with photography. So he installed massive TV screens, like ridiculously huge screens, and installed them in front of each dental chair in his 2-chair practice, just so that we could upload a photo and chuck it onto the big screen. So there's no way a patient could look away from their own oral condition. So it was about, using dental photography. It was about pointing everything out. And the other key bit of advice that he gave me that, again, this is probably more specific to me than to the general public of dentists, is treating patients like you would your family. Now, everyone loves using that tagline of, I treat my patients the same way I treat my family. We all say it at an interview, but question is, one, do we mean it? And two, do we actually know what that means? I mean it. I really, really genuinely in my heart meant it, but I didn't really understand what that meant. So, I mean, treating your patients as your family, again, going back to the issue of not being able to present expensive treatment plans to patients, meant that if a patient needed 3 or 4 full gold crowns, that was the most ideal treatment plan. If it was my mom, I'd do it straight away, and I'd take care of the costs or whatever it would be. But for a stranger, I would struggle to say 5 or 6 grand, So I'd shy away from that treatment plan without meaning to, unintentionally, with the body language that I'd be using, or with the tone of voice that would suddenly go really, really quiet. So that's where, Sam really pointed out. So treating your patients like your family means that you don't look at the budget, you don't look at the finance, you generate a treatment plan that's the most ideal, and then you work backwards, and then you give the patient the option. And it seems so simple and it seems so basic, but it was just, that's absolutely what's fundamental, and that's what I'm still seeing happening with dental students nowadays as well, with the 5th years that I tutor. They're still shying away from these expensive treatment plans, which even in a public setting are considered the more expensive options, because they're afraid of that patients can't afford something, or it's too invasive for a patient. But if it was for their mother, they wouldn't hesitate.
Yeah, that's a great point to bring up. So, I mean, at this point, you're a cosmetic dentist, Dr. Vineel here, okay, in Victoria, but you decide you're gonna uproot everything and move to Adelaide.
Yeah. Lockdowns was fun. So when I was working with Sam, I lived in Glen Waverley, and Sam's practice was in Taylor's Lakes. So that's an hour and a half on a good day, but usually 2 hours driving one way. So I was already
basically
kind of
living in the car, hey? You're basically living in the car.
Yeah, pretty much. Yeah. So I was already kind of considering dropping my days at Sam, and he was kind of considering the same. And I think COVID was just kind of a
catalyst.
A catalyst. Thank you. A catalyst for all of that. So I ended up dropping my time with Sam and stayed at home. And after about 2 months, got bored out of my mind. And then after 6-9 months of being in lockdown and not being able to wander past the 5K radius, it was getting a little bit stuffy. So I decided to uproot and move interstate. And little family history, me and my brother, we haven't been in the same state or city or anything since I was in primary school, I think. So when I said that,
coincidental or deliberate?
Coincidental, 100% coincidental. He studied his undergraduate in Adelaide, and then he moved to Sydney, and then I moved to Adelaide, and then for undergraduate. And when I came back to Melbourne, he ended up moving to Adelaide. So we always kind of missed each other. There was never really any overlap. So when I told him that I'm planning to move interstate, the natural course of action for my brother was come here. We can finally be in the same state, and it's been lovely. The last 2 years, I've got to spend quality time with my nieces, and it's just been super duper lovely. So that's probably the main reason why I'm in SA, or the main reason why I moved to SA. The main reason why I've stayed in SA is because I love my job. I really, really love the clinic that I work in, and I've told Dustin, the owner of the practice, time and time again, the main reason why I stay in Adelaide is to work here. Although, if I could have things my way, I would 100% pick up the practice with everyone in it, move it to Melbourne, and my life would be complete.
So, I mean, whilst we're on it, yeah. So what compels you to stay, in Adelaide? What about this practice? Because, obviously listeners are probably wondering for themselves, like, what's a great practice? What do you see so great in this practice?
So I've experienced mentorship on both ends of the spectrum. I've had absolutely rubbish mentorship where I had a bloke sitting in the room, sitting in the closet next to the room with the dental chair. And he'd just be playing on his phone all day. And this was early on in my practice, when what you don't know what you don't know, right? So I'd walk past the closet, check in on him every once in a while, and he'd look at me. Do you have any questions for me? I'm like, I don't know. Would you like to have a look at the case? He'll be like, nah, you good. Okay. And that was it. That was the extent of the mentorship. So I've had that. And then on the other end of the spectrum, I've had people like Sanko, who guide you through absolutely everything, identify your weakness, and give you the best feedback for you. So when I joined up with Michael and Dustin, we had very similar kind of clinical ethics and expectations. So in his practice, they don't use intraoral cameras. Everything is DSLR photography. And every DA is trained to retract and to hold the mirror in the correct position, and to use a triplex to defog the mirrors. Every single person knows how to do that. And the workflow is absolutely flawless. So that regardless of the angle or the space or how limited opening there is in the mouth, you can get beautiful shots with DSLR photography. And again, he's got massive screens installed everywhere so that, again, we can throw up those photos and look at everything and discuss it all in person. He has, I've worked in practices where you're expected to do a comprehensive checkup in 20 to 30 minutes. And that works for most people. I'm not complaining about that. It doesn't work for me. It doesn't work for my style of dentistry, which is lots and lots of talking and minimal time in the mouth. Mm-hmm. If I'm doing lots of talking at the start, spending maybe 5 to 10 minutes in the mouth and lots of talking at the end, perfect. So for that, you need about an hour. And Dustin agrees with that. So that was something that clicked for us. There's a lot of dentists, dental practices that are where the clinic is geared towards the preferences of your principal dentist, which it makes sense. They're the ones running the show. They own the clinic. Why wouldn't it be set up the way that they want to do dentistry? But the limitation to that is, if you have an associate dentist, they might not do things the same way. And if you don't have a practice that's flexible enough to work with that, it can be a really, really hard time for associates. Mm-hmm. Dustin really understands that and has a lot of freedom with that. So he has just a whole bunch of tools that he doesn't use at all, but they're there for the associates to play with as much as they want to.
For our viewers, if you like this episode, drop a comment below in your favorite part, but don't forget to like and subscribe, and we'll see you on the next episode of the CPD Junkie podcast.